Know about bile and gallbladder. Bile is a digestive fluid produced by the liver and stored in the gallbladder. It plays a crucial role in breaking down fats and aiding digestion. The gallbladder releases bile into the small intestine when needed, especially after meals. Understanding bile's function can help in recognizing gallbladder issues, such as gallstones or inflammation, which may affect digestion and overall health. 1. What color is bile vomit? Bile vomit typically appears yellow or green due to the presence of bile acids. The color can vary depending on the amount of bile and the individual's diet. 2. What food causes bile? Foods high in fat can stimulate bile production, including fried foods, fatty meats, and full-fat dairy products. Spicy foods and caffeine may also contribute to increased bile secretion. 3. What are the symptoms of too much bile? Symptoms of too much bile include nausea, abdominal pain, diarrhea, bloating, jaundice, and dark urine. Consult a doctor if symptoms persist. 4. What is bile acid in pregnancy? Bile acids can increase during pregnancy due to hormonal changes affecting liver function. In some cases, this can lead to conditions like cholestasis of pregnancy, which requires medical attention. 5. How to remove bile from the body. Removing excess bile typically involves addressing the underlying cause. This may include dietary changes, hydration, and, in severe cases, medications prescribed by a healthcare provider. 6. What does bile look like in poop? Bile in poop usually gives it a yellow or greenish tint. If stool appears pale or clay-colored, it may indicate a problem with bile production or flow. 7. How to stop yellow vomit during pregnancy. To manage yellow vomit during pregnancy, try eating smaller, more frequent meals, avoiding fatty and spicy foods, and staying hydrated. Consult a healthcare provider for personalized advice and potential treatments. 8. What happens when your gallbladder is full of gallstones? When the gallbladder is full of gallstones, it can cause pain, inflammation, and blockage of bile ducts. This may lead to conditions like cholecystitis, which can require medical treatment or surgery. 9. How do you empty bile from your gallbladder? The gallbladder empties bile into the small intestine when stimulated by food intake, particularly fatty foods. If the gallbladder is not functioning properly, medical intervention may be needed. 10. What happens when bile is high? High bile levels can lead to conditions such as cholestasis, where bile flow is reduced or blocked. Symptoms may include jaundice, itching, and abdominal pain. 11. Is bile a serious condition? Bile itself is not a condition, but problems related to bile production or flow, such as gallstones or liver disease, can be serious and require medical attention. 12. What are the first signs of a bad gallbladder? Early signs of gallbladder issues may include abdominal pain, especially after meals, nausea, bloating, and changes in bowel habits. 13. What does bad gallbladder poop look like? Stool may appear pale, clay-colored, or greasy due to insufficient bile reaching the intestines. This may indicate a gallbladder or bile duct issue. 14. How do you know a gallbladder needs to be removed? Indications for gallbladder removal include recurrent gallbladder attacks, severe pain, complications from gallstones, or signs of infection. A healthcare provider will conduct diagnostic tests to determine the need for surgery. 15. How to remove bile at home. To remove bile at home, eat low-fat, fiber-rich foods, stay hydrated, use herbal remedies like peppermint and ginger in meals, and exercise regularly. Consult a doctor if needed. 16. What vitamins are bad for the gallbladder? Excessive intake of certain fat-soluble vitamins, A, D, E, K, may stress the gallbladder, especially if there are existing gallbladder issues. Always consult a healthcare professional before taking supplements. 17. Can you live without a gallbladder? Yes, you can live without a gallbladder. The liver continues to produce bile, which flows directly into the intestines, although digestion of fats may be less efficient. 18. How can I check if my gallbladder is okay? Checking gallbladder health typically involves medical imaging, like an ultrasound, and blood tests to assess liver function and bile levels. Symptoms and medical history are also considered. 19. Can a gallbladder cause gas? Yes, gallbladder issues, including gallstones or inflammation, can lead to digestive problems that may cause gas, bloating, and discomfort after eating.
Thank you very much for watching my video. I do hope these 19 questions and answers have provided you valuable information about bile in gallbladder. Take care of your health, and if you are satisfied, kindly do not forget to subscribe my channel.